something that's really topical at the moment, especially in places like Oregon, but also actually in the UK. The 2018 heat wave kind of caused 8,500 excess heat-related deaths in the UK. And I think that's going to be something we're going to see more and more, having the heat having a direct effect on health. But that's not the only way that the climate crisis impacts health. There's kind of more indirect ways, so the impact that it has on things like food systems, our ecosystems. Crops grown at higher carbon dioxide levels are more likely to have micronutrient deficiencies, or how we grow enough food to feed everybody on the planet in itself. So I think it's really easy sometimes to think about it as something that's quite far away from us and quite far away from us as healthcare professionals, and to kind of think about it as polar bears and ice caps melting and so on, which can feel quite distant, especially if you're busy doing a clinical job. But actually, more and more, and there's been more and more evidence, more and more research around this, like the number one reason why we all need to care about this, everyone listening to this podcast, is because the biggest impact the climate crisis is going to have is on all of our health and our ability to lead a healthy life. I think the first thing to do is to start to talk about it. And I think students are beginning to learn about it more, but often when we speak to people, despite air pollution being this huge cause of ill health, very few people have received any education about air pollution at all in their medical school. Every conversation you have will get people thinking about it. But it's not easy, I think, and I think it's something that we're still kind of learning, kind of feeling our way through in terms of where this fits in best, how best to talk about it. But that doesn't mean that we shouldn't try, because we absolutely need to, because it's part of our responsibility as doctors and as kind of educators of future doctors and other healthcare professionals.
So I think that the wonderful thing about simulation is that at the heart of it, certainly when I did my teach the teachers or train the trainers, was that it's about frame challenging. So when we debrief, we're seeing what people have done, and people do things according to the framework that they have for that thing, and then we challenge it. Then we say, okay, so this is why you did that, this is why this happened. You kind of talk about kind of how did that happen, what are the reasons for it, and that lends itself perfectly to rethinking what it is that we're doing here, and what our roles are, and kind of what happens in those interactions between us and patients. And maybe we could move to using simulation in a kind of slightly less kind of hyper acute way, and start to maybe think about simulating kind of more routine discussions with patients, and kind of how you would interact with people on a kind of slightly more day-to-day basis.
So I think that your idea of using simulation to kind of for communication is happening in so many different domains that you could definitely extend it to either how do we talk to our patients about the climate crisis and how it affects them? Because these are, let's be honest, they're challenging conversations, because they really challenge who we are and the way that we live our lives. And they can feel incredibly personal, and can, just be really, really difficult conversations to have.
Absolutely. And I think there's something about the fact that this is also quite a new area in that. So using the simulation lends itself really well to that, because it's not something that we're used to doing, but it's also not something we're used to seeing other people doing. So actually simulation's a really nice way of being able to kind of play out what is the best way of having this conversation with our patients, because we don't know. There isn't kind of an established framework for that.
That's one of the really wonderful things about simulation, and you guys have both alluded to this, is debriefs and being able to explore. And we just don't have that time for that, I think, in normal didactic education, where you're trying to get a bunch of information across, or even just in clinical practice.